With the continued spread of COVID-19 globally, organisations are scrambling to protect their employees and their operations. One way to protect your employees and stop the spread of the virus is through adequate sensitisation of your workforce. What is COVID-19? COVID-19, an infectious disease caused by a member of the coronavirus family that has never been encountered before. This new virus and disease were unknown before the outbreak began in Wuhan, China in December 2019. On March the 11th, 2020, the World Health Organization, WHO, assessed COVID-19 as a pandemic. According to the World Health Organization, as of April the 4th, 2020, there are about 1,050,635 confirmed cases, with 56,985 deaths spread across 207 countries. This number continues to increase by the day. COVID-19 is a serious health threat and the situation is evolving daily. The risk will vary between and within communities, but given the increasing number of cases globally, the risk is considered high. COVID-19 in Nigeria. The first confirmed case of the pandemic of coronavirus disease 2019 in Nigeria was announced on the 27th of February 2020, when an Italian citizen in Lagos tested positive for the virus. According to the Nigeria Centre for Disease Control, NCDC, the number of confirmed cases as at April the 3rd, 2020 had reached 209, with 4 deaths recorded. All COVID-19 related cases should be reported to the Nigeria Centre for Disease Control, NCDC, immediately. Can COVID-19 be transmitted through the air? Studies to date suggest that the virus that causes COVID-19 is mainly transmitted through contact with respiratory droplets rather than through the air. People can catch COVID-19 from others who have the virus. The disease can spread from person to person through small droplets from the nose or mouth, which are spread when a person with COVID-19 coughs or exhales. These droplets land on objects and surfaces around the person. Other people then catch COVID-19 by touching these objects or surfaces, then touching their eyes, nose or mouth. People can also catch COVID-19 if they breathe in droplets from a person with COVID-19 who coughs out or exhales droplets. Symptoms of COVID-19 globally. Those who are infected with COVID-19 may have little to no symptoms. You may not know you have symptoms of COVID-19 because they are similar to a cold or flu. Sometimes symptoms may take up to 14 days to appear after exposure to COVID-19. This may vary across persons. The symptoms of COVID-19 are cough, fever or high body temperature, difficulty in breathing. Some patients may also have a runny nose, sore throat, nasal congestion, fatigue, aches and pains, or diarrhea. What should I do if I have any of these symptoms? Coronavirus infections can only be diagnosed by a healthcare provider based on symptoms and are confirmed through laboratory tests. If you are showing symptoms of COVID-19 listed, reduce your contact with others. Isolate yourself at home for 7 to 14 days to avoid spreading it to others. If you live with others, stay in a separate room or keep a 2-meter distance. Visit a healthcare professional or call your local public health authority. Call ahead to tell them your symptoms and follow their instructions. If you become sick while at work, immediately excuse yourself from your workspace and stay in an isolated area. Inform the HR department of this development and wait for further advice or actions. There is currently no cure for this virus, but you can make yourself feel better by taking lots of fluid, getting some rest, taking paracetamol. Prevention. It is our collective responsibility to stop the spread of the virus by taking the basic precautions. Practice social distancing. Social distancing is proven to be one of the most effective ways to reduce the spread of illness during an outbreak. This means making changes in your everyday routines to minimize close contact with others, including avoiding crowded places and non-essential gatherings, avoiding common greetings such as handshakes, limiting contact with people at higher risk like older adults and those in poor health, keeping a distance of at least 2 arms lengths, approximately 2 meters, from others. Practice proper hygiene. Proper hygiene can help reduce the risk of infection or spreading infection to others. Wash your hands often with soap and water for at least 20 seconds, especially after using the washroom and when preparing food. Use alcohol-based hand sanitizer if soap and water are not available. When coughing or sneezing, cough or sneeze into a tissue or the bend of your arm, not your hand. Dispose of any tissues you have used as soon as possible in a lined waste basket and wash your hands afterwards. Avoid touching your eyes, nose or mouth with unwashed hands. Use of face mask is also advised. While at work or in public places, avoid opening the door with your hands. Use alcohol-based hand sanitizers after every contact with surfaces or objects handled by other persons. Avoid hugging colleagues and friends. Avoid handshake during this period. Adopt the Wakanda style if you must. Oh, and to the females and of course everyone taking this course, here is a useful tip. Avoid touching men. Meaning avoid touching mouth, eyes, nose. Fatality and recovery. COVID-19 infection is not an automatic death sentence. It is comforting to know that more people have recovered from COVID-19 compared to those who succumbed to it. Most people with mild coronavirus illness will recover on their own, but in severe cases, infection can lead to death. This is supported by the World Health Organization, WHO, statistics on COVID-19. Vaccine. At this time there is no vaccine for COVID-19 or approved health products to prevent or cure COVID-19. Ignore the rumours making the rounds about purported treatments. However, there are several ongoing clinical trials that include both Western and traditional medicines.